Welcome to Clinical Conversations. On today's Smart Chiropractor Show, we are going to revisit a portion of a presentation from Axis 2021, which was our online clinically focused event. Axis 2022 is going to be coming up, so stay tuned for details. But we're going to look back at a piece of a talk by Dr. Sam Wang. Sam is one of the most successful licensees, franchisees. He has grown a multi-unit location to a level that very few chiropractors have. And Jason had a fantastic conversation with Sam about the biggest mistakes chiropractors make when scaling multi-unit locations. So if you are listening and watching, and you're either somebody that this is something you have in your mind in the future, or you're actively going through this process right now, there's a lot to be learned by somebody who has already done it at the highest level possible. We're going to do a little sneak peek into Dr. Sam Wang and his 3 biggest mistakes in scaling multi-unit locations.
We're going to go right into the meat of this and talk about the first mistake. And a lot of times the error is that people think, 1 + 1 = 2. And if you've ever been a parent or you're currently in it deep raising children, the first child was the experience that you had. But then as soon as you add another child into the mix, it wasn't just a replication of child 1, right? Because you have that second dynamic called, well, I still have child 1 and now I'm bringing in child 2. And so a lot of people just think, well, I just have to reproduce what I just did with the first experience of the first practice. And that's not always the case. And most of the time it isn't the case. And what I really found is many doctors, as we get excited about wearing the entrepreneurial hat, dive into clinic number 2 prematurely, meaning they haven't truly and consistently reproduced success in clinic 1 before they ended up going to clinic 2, 3, or 4. And that just then accelerates the pain points of navigating through operating a business even faster. But the challenge is then your risk of the expense, right, and the cost to start those and to then manage and staff those businesses becomes overwhelming and eventually leads to a demise of the business. And that has nothing to do with, again, the clinical aspects of that provider, right? And so what we're going to hit here with 1 + 1 = 2, the fact that what made you successful at one location definitely is not going to be enough to make you successful in the next. And predominantly that's going to be because what I found through researching successful chiropractors, especially doctors out there that promote that they're, doing well in whatever type of practice and business that they operate, it's usually a one-man show. They are wearing multiple hats, and they have that bandwidth to be able to do it. They have the energy to do it. They have the intelligence to do it. And then they lead their teams into a successful business, right? And then when they open clinic 2 or business number 2, they think, I just have to do those same things and stretch more. But again, as I mentioned earlier, as we're all limited to those 24 hours of the day, you could for sure decide to minimize the amount of time that you take off or sleep. But at the end of the day, we there's only so much bandwidth. And I noticed that people then use and rely on their individual talents as opposed to what we just shared earlier, creating systems, creating true replicatable systems so that it's not reliant upon talent of the individual doctor, that it's now focused on team and the management of the organization, right? Part of the systems that we've gone through to standardize is the training, right? So again, the first thing you do to scale is to then reproduce yourself. And in doing so, you need another strong clinical provider, right? That is then clear on what it is that they're learning. And so if you don't have a defined clinical system that you're adhering to outside of what's inside your brain, and it's not written down, that's step one, that you're going to have to make sure that there is a clinical system. There are a lot of great references out there in terms of guidelines, musculoskeletal guidelines that you could use. Most institutions, sometime while you were a student, had a clinical manual that you could follow. And most state associations offer toolkits to follow as well regarding how you're going to document, how you define short, long-term goals, and then most importantly, how you're going to measure those patient outcomes, right, to really generate the success overall. And so we created in Chiro One an actual fellowship training program because, again, inherently, it's not out there. It's hard to find. And unless you know where you're looking for it, we wanted to make sure every provider coming through our organization got the same introduction and the same information to then be able to reproduce the same clinical outcomes that we told how great our patients love our doctors and our practices. So we went through a 12-week fellowship program that consists of clear and precise office procedures and protocols, because I think the best value prop besides getting patients out of pain and improving function is we're there, we listen, we like to be a part of our patients' lives. And so when you look back at net promoter scores or customer service satisfaction surveys out there, patients always say, my chiropractor spends more time with me, right? And many times that isn't necessarily a quantitative, it's more of a qualitative value that then they go, oh, I didn't realize it. It felt like it was, 10 minutes or 15 minutes, even though it was a 2-minute conversation. But reproducing and training how to have those conversations are really, really important. And then most importantly, where the support staff, your CAs and CTs, add into that value because they are the extension of you, the provider. And you want to make sure that, again, they know where to go and where to be and the conversations to have that you would have personally and be able to reproduce that again. And then talking about those outcomes, are you following a standardized treatment recommendation program? If the same patient or the same case with the same condition came into your practice today, as opposed to 6 months from now, would you prescribe the same frequency and duration of care for that patient? Would you recommend the same services? And notoriously as an industry, we just have this reputation that if you visit 10 chiropractors, you're going to have 10 completely different experiences, right? And so that consistency around managing your patients' cases and following a set of guidelines is going to be important, not just for you, but also then for the additional providers that you bring onto your team, including when you then scale to multi-unit, multiple locations, that everybody is following that same protocol, right? And then lastly, all the things that we learned through trial and error, through years and years of practice experience, the professional development of learning what to say, how to say it more efficiently, so that then you optimize that conversation as opposed to taking 2 hours to convey a single message, right? And so we spend the last 30 days focused on how do we improve the communication or the public speaking aspects so that when you do your report of findings or you do your group lectures, that patients get that aha moment as opposed to, doctor, that was great information, right? They just know you're smart. And that's not the outcome we want coming out of that. So we've standardized the clinical model through a fellowship training program. We also understood that even hiring, because again, this isn't a job that we're ever trained in chiro school, how to go through and pick the staff that supports, right, the team in that practice. Where are the weak points and how to identify hiring somebody to fill in those weak points so that the team is stronger and creating a model that you can reproduce over and over again, which was really, really important. Definitely investing and focusing on hardware as well as software, right? FF&E is what we call it, fixtures, furniture, and equipment, right? To support the level of care that you want to provide. And so you have to make sure that whatever you decide to purchase for Office 1, that you then duplicate for Office 2, as opposed to the second office. Many times I've seen in a new chiropractor or a new entrepreneur's business as the kind of stepchild, right, syndrome, that they get everything used or they get kind of piecemeal ad hoc equipment until that office achieves a certain volume of success. And I would say start it the other way around. Be consistent with how you manage, right? Practice development, performance is the underlying, it's part of the three-legged stool in our industry, right? From marketing and patient acquisition to revenue cycle management to then practice management in our business kind of entrepreneurial world. And so you have to be sensitive to not all providers and not all staff members relate or resonate to different styles of management, and to be aware of what style you possess, right? And then also the styles of learning that your staff and your additional support providers have, to be able to mirror them appropriately is crucial. And I think it's a really key success formula for that. And then, as really, really important, I think a lot of chiropractors bypass this because we know just through anecdotal, subjective, conversations we have with our patients that patients are getting well. But as chiropractors and as an industry wide, we have to demonstrate the measurement of those, right? And although it's a 20-year-old, 30-year-old conversation to use validated outcome assessment questionnaire tools, let's measure those objective findings clinically so that you can show reproducibility in the various cases and conditions that we're managing in our clinics.
Great information from Dr. Sam Wang. He is somebody who has just about more experience than anybody else scaling multi-unit locations. Great practical tips there to implement. Even if you don't have a multi-unit location, those are probably really great ideas to implement in your practice. Jason, what do you think?
It's awesome to understand, Sam. Basically, I think of them as having the largest practice on the planet because they are all corporate owned. They're not franchises. They're all owned, operated, and run by Sam and his team. So wealth of experience. There's a lot of nuggets in there. If you are going down that road or thinking about working for a group that is on that road, knowing this information is super helpful. Just makes you smarter, makes you understand how things work a little bit better, and gives you options and choices. When it comes to chiropractic, you may want to scale. In our belief these days, you may want to generate some monthly recurring revenue to automate some of your financial future. Sam's just a great guy. I've had a lot of great experiences with him in a lot of different places around the world, and it was really a great conversation to have with him.
And stay tuned for Axis 2022. That was a look back at Axis 2021. Axis 2022, our clinical online event, will be coming later this year, so keep an eye out. Thank you so much for watching this video on The Smart Chiropractor. To not miss a single thing that's clinically oriented, marketing oriented, or more, be sure to subscribe to our YouTube channel today.